veterans have had trouble accessing the care that they need and that they deserve for a really long time. So about 15 years ago, we got the community-based outpatient clinic, which was supposed to be this big win for veterans here. And in some ways it has been, because now veterans don't have to travel all the way to Spokane or to Seattle, and yet it's been really hard for them, and even more difficult lately, to get through on the phones, to access the online portal, to have that portal not crash, to get in for an appointment, to see a specialist, even to wait for a pair of glasses. So there have just been a multitude of frustrations that I'm looking to get to the bottom of so that I can help solve the problem.
And you questioned the Deputy Secretary for VA during that hearing, and maybe you've made other inquiries as well. So what have you been able to learn about what might be causing these backlogs or these unavailabilities?
It was really just a fact-finding mission. Our veterans are having trouble. We got to get answers. It seems to be related to these things. One of them might be the new electronic health record called Cerner. One might be just employees leaving and disillusioned and feeling burnt out. But what else is there? Like, how can we get to the root causes? And it's been interesting for me to look at as a physician, because so much is being blamed on this one healthcare platform. I don't mean to get too much in the weeds, but it seems to be even deeper than that. And so we're looking at things like implementing a new system, a system that works well at my old employer and at Madigan, but is not working well for the VA, and figuring out why they even have different systems. If you've got a system that works, why aren't our veterans getting that system? And when people get frustrated with an online portal, where do they go? They go to the phones. And so then there's an unbelievable volume of phone calls, and there's just frustration all around. So I'll be taking this back to Secretary McDonough and pushing and pushing until our veterans are happy.
And the CBOC here in Wenatchee reports to the man-grant-staffed VA Medical Center in Spokane. Has that center, or VA generally, been able to provide any figures for you roughly on how big these backlogs might be? How many veterans are in the queue still awaiting for this kind of help?
They have not given that information. And in all fairness, I don't know if they know. I mean, you call a certain number of times. We even had our staff call just to see how bad this was, and it's really bad. People just give up, and we can't have that happening. They had our backs. We need to have theirs.
Well, we talked about the inquiry in Congress. Are there other steps you've been able to take on your constituents' behalf to try and help them resolve these problems?
So one of the things that anybody listening should know is that your member of Congress is there specifically to help navigate federal agencies that can be a real hassle to navigate. So we have helped many veterans who just called our office get an appointment with a specialist, get the equipment they need, get through. So yes, if you feel like you are banging your head against a wall to deal with, whether it's the VA or Social Security or you name it, call our office.
Tell me about Douglas County Veterans Services and the kind of things that you're able to do for veterans.
One of the main things that I have to do is manage the Douglas County Veterans Relief Funds. So there's a portion of the home taxes that go into a fund. That fund is specifically set aside to help veterans in need. Those Veterans Relief Funds can help with a veteran who has an unexpected medical bill or needs a small vehicle repair to get to medical appointments or a job. Help with electricity or gas, anything. If a veteran finds themselves in a rough situation and just kind of needs a little help out of it, that's what those veteran relief funds are for. The other main part of my job is helping veterans get connected with federal benefits through the VA, either the VA healthcare system, or VA benefit system, or survivors of veterans applying for burial reimbursement.
How many veterans are you working with in Douglas County? Whether that be a number of people who seek your help or people that you're just aware of who are veterans in Douglas County?
Well, according to my metrics, the things that I've been able to keep track of, since January 2019, I have assisted at least 1,000 veterans. And those are just the ones that I've actually done casework for. That's not answering the phone and answering questions or talking with people or going to events to help with information. The veteran population in Douglas County, last I knew, was about 15% of the people living in Douglas County are veterans, and I would consider that a rather large percentage of people in that area. Not all of them seek help. Not all of them attempt to get benefits from the VA, either through healthcare or benefits along those lines. And a lot of them don't even understand what's available for them. So that's something else that I try to do in my office, is let people know that not only my office exists, but as a veteran, there are certain things you're eligible for.
How many of those folks do you think have come to your office seeking help with their VA medical claims?
Well, when it comes to VA medical, I can help people get apply for it and get the eligibility in that way. I've helped about 45 veterans apply for VA healthcare, and there are other veterans who've come seeking other assistance who were either already in VA healthcare or were fortunate enough to have other options, either through private health insurance or things along those lines. So yeah, about 40 of the people that I have personally helped get enrolled in the VA healthcare system.
Now, you came into the VSO position after a military service of your own. Can you tell me about your military service?
Yes, I served January 99 to December 2004 in the Air Force. At first, I was a security forces patrolman, so I was patrol cars and gate guard duty and armory and things along those lines. I had the opportunity to cross-train into financial management and found out that I like desk jobs a lot better.
So the financial management end probably helps dealing with those veterans funds that we talked about earlier.
Yes, it really does help. Part of my office is to make sure that I cover the budget. My office is funded totally by those veterans relief funds, so I have to ensure that they are available for the relief claims that come in.
Now, Wenatchee is fortunate enough to have a community-based outpatient clinic for VA medical services here. And as you say, you can sometimes help veterans get started on making their medical claims. When folks here are seeking aid through our local CBOC, what are some of the issues or complications that they encounter in terms of getting their medical claims fulfilled through our local office?
Well, since we've moved here in 2009, both my husband and I are veterans, and we're already enrolled in the VA healthcare system, so we re-registered in the local area. The main problem that we've had, even just since we've been here, is for some reason the phone system. When you call the number that you're given for the local Wenatchee clinic, you are not connected with somebody at the front desk at our Wenatchee clinic. You're connected into some sort of a phone tree in Spokane. And I have no idea how it happens, but myself and my husband both have somehow ended up talking to a pharmacy tech in Walla Walla, or somebody in Idaho, or somebody in Oregon in the VA system, simply by attempting to call our local clinic. And so that has been one of the largest problems and continuing problems that I know of for our local clinic, and I don't know why that's in place or how to fix that, but that's one of the main things that always comes up. The next thing would be that there is timely access to appointments, and I know this has become a federal issue. Literally, they have said, hey, you have to get people in, and the VA has really tried to help get that so that veterans get appointments set within 3 weeks, if I remember correctly. Well, you can get a response and get that appointment set within 3 weeks, but that doesn't mean that appointment itself is in 3 weeks. So the VA can meet their metric of saying we're meeting this need, but the veteran themselves actually doesn't end up getting in for 2 or 3 months. The other thing is access to community care. The way the VA handles community care, they contract in our area through Tri-West, which is an insurance company. So the VA themselves contract with Tri-West, and Tri-West contracts with local providers. Those local providers have to jump through flaming hoops and mountains of paperwork and months worth of waiting time to be considered a provider in the community for a veteran. So not only the providers are having a problem getting connected with Tri-West to work for the VA, the veteran themselves can be confused in how exactly that works. So a veteran cannot just walk into a local chiropractor's office and say, I get my care through the VA, would you please give me care? The veteran has to contact their primary care provider at the VA. That primary care provider has to put a referral in. That referral, if it's going to be in the community, has to go through the community care office in Spokane, who then contacts the veteran to ask them their preferences, takes those preferences, gives them to Tri-West, and then Tri-West takes those preferences, contracts with the local contractor, who may or may not directly get in touch with the veteran, or Tri-West will get in touch with the veteran. It is just an amazing pile of just confusion and paperwork on both ends of things. And in that, it takes weeks or months for a veteran to get a chiropractic appointment. And if you apply that to behavioral health issues, that's not good. For prescriptions, very not good, especially if that is a life-saving prescription that you need.
Are you able to help a veteran who comes back to you and says, my call won't go through, or my appointment is deferred for months and months? Are there other steps you can take?
Not personally in my office. That's not the area that I have access to, in a way. There are caseworkers at the local clinic and patient advocates at the Spokane Medical Center. Then I attempt in my best ways to refer people to them, because they're within the VA healthcare system and they can help with any follow-up when it comes to those kinds of things.